Morning, Stephen.
Morning, Stephen.
Gemma, are you ready to go?
Yes, it's on.
Thank you. Good morning, everybody, and welcome to our Isles of Scilly Local Outbreak Engagement Board on Tuesday, the 22nd of September at 9:30. This will be a virtual meeting with a remote attendance by councillors and remote access of press and public, and will be held in accordance with the provisions of the local authorities and police and crime panels, coronavirus, flexibility of local authority and police and crime panel meetings, England and Wales, Regulations 2020. And I'd like to welcome you all to this meeting. First of all, I would like to ask for any declarations of interest, please. No? Okay, thank you. Item 2 on our agenda is to take the minutes of our meeting of the 11th of August. If there are no issues with those minutes, could I have a proposer and seconder, please?
I propose those minutes, Chairman.
Thank you, Councillor Grottick. And a seconder, please?
Yeah, I'm happy to second them.
Thank you, Councillor Williams. Are there any attendees to this board who are against the adoption of these minutes? Then they're carried. Thank you very much indeed. Item 3 on our agenda is our local outbreak and evacuation plan in the hands of our senior officer, Tanya Saker. Thank you, Tanya.
Hi, morning all. I can give you an update, but I wasn't sure if you just wanted to go to Whitney first in terms of providing an update on the national situation.
Okay, let's do that then. Dr. Whitney Curry, if you're able to come in on this now, thank you.
Morning, and thanks for having me. Yes, I think it's probably a good idea to have a little chat about the national picture at the moment before we get into what the alert's been up to. So I'm sure you will have seen in the media and any data that you follow with us online that nationally we're seeing an uptick in cases. You will see if you follow the .gov email update that there's local lockdowns throughout the country in various ways, different types of lockdowns, different restrictions in different areas. And that's the idea. So at the moment, the system is working the way it's meant to work in terms of you look at the local area, the local issues and the local need, and you respond in a local way. So that's currently what's happening. And there's a few things to understand about what's going on with the increase in cases. One, I don't dispute that cases are probably rising. But we also have to remember that we're having a real increase in testing for all the issues that I know testing is having on the mainland. And this is far more tests that are happening than we ever had throughout the entire lockdown period. So actually, when it looks like we're having a massive increase, we don't really know because we don't have accurate information to compare that to because there just wasn't any testing for the general public. It was all for the NHS and frontline care staff. So it's just good to keep that in mind. It's very, very good that you will have the likes of the Chief Scientific Officer who did their media briefing yesterday to remind us all that because of this testing, we know when there are cases and we know what to look for in terms of increases so that we're prepared and ready to act as needed. So although I think, in the media it gets a bit panicky, I don't think there's any reason to at this point. It's very, very good to remind us all that we've got to be following the prevention messages, which I'll be honest are sometimes confusing, but that's why we've got our colleagues on the island to help us point us in the direction of the good communications and prevention messages. And that the coronavirus is still circulating. We're not out of the woods, and we're going into a winter period where snotty noses, flu, and COVID will be circulating at the same time. So we can expect for things to get a bit more, I think, complicated in the winter time. I think you've probably heard that there might be an announcement this evening in the media around further restrictions. If that happens, we'll deal with that as it comes. We don't get any advance notice of what these restrictions are going to be, just so you're aware. We get notice as these in terms of the central announcements, central government announcements. We get them at the same time as you, and we pick them up and we run with them as required. So we're well prepared. Our Outbreak team is well prepared to do that. Your colleagues throughout the local authority and health system who are working with us are well prepared to deal with any of those types of announcements that come. What I would say is just keep yourselves up to date. Any updates on the .gov guidance, make sure that you can sign up for email updates, and just make sure that you're checking regularly to see if there are any updates. Because while the media will report lots of things, it's good for us to see it, the guidance written down, and make sure that we're understanding exactly what's being asked of us. The other thing was to say that the National Test and Trace app will be available from Friday. Your environmental health colleagues have been working with lots and lots of your business partners to ensure that everyone is prepared to be able to support that app through their businesses. So it's like a QR code that patrons can scan when they come in, so that the app can sort of follow everyone. We know where contacts have been, et cetera, et cetera. So that's launching from Friday. We'll see how it goes. It's untested for us, but your environmental health colleagues are well on top of it, and the businesses have been, I think, very receptive to being able to use those new features. That's kind of a national update. In terms of any lockdowns in the winter for anyone else, other than what's been going at the moment, again, lockdown comes down to a central government decision. For us, if we needed to, it's a containment type of situation. That's what we control locally, just so you know. And when we get into that, if we get into that situation, that's where we use engagement board to really engage with our public and get information out there. But we're not to that point yet. But just so you know, there is that distinction between lockdown and any containment. Okay?
Thank you very much indeed, Dr. Curry. Are there any questions, please, to Dr. Whitney Curry?
Could I sorry, it's Amy on the phone. I've just got a quick query about the QR codes. I can't find the definitive whether it's self-catering accommodation needs to provide them or not. Or whether sorry, go on.
No, go ahead. I'll get with our environmental health colleagues. I'm not sure. I'd have to go straight back to the guidance to find out.
Okay, thank you. Yeah, it's not very clear because obviously we've got the information anyway from the bookings, so we've got the names and numbers.
Yeah, I
just didn't know whether we needed the codes as well.
Yeah, I would say the direction of travel is that we'll all be using this National Test and Trace app at some point anyway. And so I think getting on board sooner rather than later is great. And then it helps support you, because I think at some point the transition will likely be to that anyway.
Yeah, okay.
Yeah.
Thank you.
Thank you. Are there any other questions, please, for Dr. Curry? No? Well, thank you very much for that update. So we'll move back now to Senior Officer Tanya Saker.
Thanks, Robert. Okay, so in terms of what we've been doing, just to reiterate, we do have a local outbreak plan in place, and this is currently being quality assured through our colleagues in Cornwall. So that is in place and ready to go should we require it. As you know, we have an evacuation plan in place. I'm pleased to report we haven't had to use the evacuation plan over the last few months. And as Whitney did suggest, we have been testing and we continue to test. And we have been testing some visitors. And I should say that the accommodation providers have been fantastic and incredibly supportive and been able to keep those visitors in their accommodation whilst we test them and whilst we get their results back, which is even better. So we haven't had to use the evacuation plan, which is good news. Testing continues. We have been testing throughout the summer period, and we're using the Pillar 1 testing process. So that isn't the Pillar 2 testing process that you've been reading about in terms of having issues on the mainland. This is our enhanced bespoke testing service that gives us direct access to to the microbiology lab at Trellisk Hospital. I'm also pleased to report that we're seeing some of these tests turned around in less than 24 hours, with an average of around 30-hour result time coming through. The Cornwall blood banks continue to support the Council's transport swabs to Trellisk Chronasis, for which we are hugely grateful. And as we move into the autumn and winter period, we are looking to expand our testing team, ready to gear up for increasing testing demand as we see those colds and sniffs and snivels and temperatures. And as Whitney said, just to reiterate, we will only be testing those individuals that do have those 3 key coronavirus symptoms. I can also report that Cornwall Foundation Trust are currently recruiting for a new mobile testing coordinator. So we obviously lost our testing coordinator earlier this month, but we are hoping Cornwall Foundation Trust will be appointing someone soon, hopefully. However, in the meantime, I can reassure you that the Council's emergency planning team is continuing to meet the demands of test requests through the delivery of self-administered tests across the island. At the last full council, we approved the Contain framework, which was adopted and will regularly be reviewed alongside Cornwall's Contain framework moving forward. So this document identifies the trigger levels over the 5 key stages of how the council and public health define where we are and how we respond. And just finally, just to let you know that the Strategic Coordinating Group, the Local Resilience Forum, had a meeting yesterday, and they're looking to stand up these regular meetings on a weekly basis, which Paul will attend. That's pretty much it for me in terms of an update on where we are with testing, if anyone has any questions.
Thank you very much, Tanya. And before we go to questions, I would just like to register my thanks to you especially and to your testing team for the work that you've been doing. I'm aware that you've been working all weekends and so on, all sorts of hours doing this testing and making sure everybody's tested as required. And it's been an immense effort from you all. Thank you very much indeed from all of us.
Thanks, Robert. I'll pass that on to the team.
And the community. Thank you. Councillor Grottek.
Thank you, Chair. I seem to have lost my raise the hand bit on the toolbar. Just to clarify, obviously the key symptoms are the temperature and the loss of smell, taste, and smell. A test is valid if somebody only has one symptom, isn't it? Because I gather that the loss of taste and smell can be the only thing that people notice.
Shall I respond, Chair? It's Whitney.
Yes, please. Thank you.
Yes, that's absolutely right. You only need to have one of the 3 symptoms to qualify for receiving a test. That's correct.
Okay. Thank you. Are there any further questions, please? Councillor Williams, thank you.
I assume as we move into the winter flying schedules and flights are less frequently than the current time, then we're likely potentially to see an increase in the time it takes to turn tests around purely from a logistics point of view.
Shall I answer that one, Whitney? Potentially. I mean, we can always fall back to using the boat. So our first route off the island is always by flight. As you know, we can struggle with weather and fog and various weather conditions which can impede that process. However, we can resort to using the boat on a regular basis. Obviously, when the boat stops later in the year, then yes, we might have issues whereby we can't get the tests off the island as quickly as possible. However, we are continuing to push through the local peninsular testing framework for forms of additional testing and different types of testing that we might be able to trial or adopt here on the island. So whilst we are restricted to some extent, or we will be restricted when the boat stops running, we are looking at ways to improve testing turnaround moving forward.
Okay. Thank you very much. Any further questions, please? Okay. Well, could I please have a proposal that we note this report, please?
I'm happy to propose that, Chair.
Thank you, Councillor Grottet. And a seconder, please.
Yeah, happy to second it.
Thank you, Councillor Williams. Anybody against the noting of this report? No. Thank you very much. Then we move on to item 4 on our agenda, which is technically the report from the Director of Public Health, but we've pretty much taken that under the last item, I think. Whitney, is there anything further that you would like to talk about today, please?
The only other thing I think is worth to mention, which we did just briefly touch on with one of your councillors' questions around the symptoms. So one of the things as we move into the winter is that we will see more colds, snotty noses, things like that going around. And it's really important to remember, and we should all be doing this anyway, but it's even more important in the time of COVID, is that even if you don't have the proper COVID symptoms, it's still up to all of us to make sure that we're staying home if we don't feel well. So we've got to protect each other from all the other bugs as well, because it's so difficult to tell sometimes the difference. So please can I remind us all that prevention is really key here, and we can all help with that. So if you're not feeling well, your child's not feeling well, if at all possible, keep them home. And then if it's a coronavirus symptom, you isolate anyway and get a test. But other symptoms of feeling unwell, stay home until you feel better and then go back in. I think we saw a bit of an uptick in our testing, obviously when schools went back, because, you've got, as much as I love them, snotty-nosed children running around, and it's very difficult oftentimes to be able to tell. And we've sussed that out. The school have been so proactive and so great and very good communication with us. So we've got our sort of procedures in place with the school now and how we handle children and testing. But I think for wider community, it's really important that we remind everyone, stay at home if you're feeling ill.
Thank you very much, Dr. Curry. Councillor Legg, please, the question.
Thank you. Not so much a question, just wanted to agree with Dr. Whitney Curry on her last statement there. In these times, it's really important to avoid transmission of anything that may appear to be COVID, even if it's not, because that can have disastrous consequences for businesses and the economy if they have to close because they are symptomatic, even if they are not testing positive. Purely symptomatic can cause issues logistically and economically.
Thank you. Any other questions or observations, please, for Dr. Curry? No? Well, then, could I please have a proposer that we note the report from the Director of Public Health? Councillor Legg, thank you. Seconder, please. Councillor Grottek. Anybody against the noting of the report from the Director of Public Health? Thank you. Then that carries. Item 5 on our agenda today is communications. I'd like to hand over to Senior Officer Tom Walton, please.
Thank you, Chairman. So since the last meeting, we've had a letter going to all residents on the island. That was giving an overview of the work that the council is doing and the various points of contact that they might need if they need to get in touch with anyone relating to the pandemic. The intention of that letter is just to make sure that we've covered everyone, particularly those without access to the internet, etc. So we obviously have daily updates going out over the internet, but it doesn't necessarily reach everyone. And that letter, was very well received. People were very grateful to get that, and hopefully that's allowed us to get the main local messaging out to everybody. As has already been covered by Whitney and Tanya, we're promoting the local route to testing. There's technically a national route and a local route, but obviously there's been big pressure on that national route to testing, and currently that local route is much quicker. So throughout all our testing communications recently, we've been promoting the local route as being probably the best option for most people. There's also been a lot more emphasis in our comms on symptoms. So Whitney clarified there are 3 symptoms relating to coronavirus, but you only need to present one of those symptoms in order to qualify for a test. And that's been really important, particularly with the children starting school recently. There's been a lot of cold symptoms, etc. So it's really important to make sure that we get tested when there is a symptom presenting, but if it's things like sniffles, etc., it might be important for the child to stay home, but not necessarily take up a test from the pressured system. The other major thing that's been out recently is the rule of 6, so imposed by central government, which is groups of 6 people, but no more can get together at present. It's been really important to sort of get that across to everyone in the community to make sure that they take that seriously, and that we don't get any sort of inadvertent mixing of groups, etc. We've completed our pre-prepared messaging, which is relating to if there were any kind of sort of lockdown locally. Let me clarify, lockdown, it's more of a containment in the language that Whitney was using earlier. Lockdowns are imposed by central government, but if we had to contain to a particular area, we have pre-prepared messaging, and that's with our public health colleagues, so that they're just giving their input on that at the moment. But it's just important that should anything happen, we're prepared and good to go within a matter of minutes, depending on what's gone on. We released another chairman's statement last week. That was in recognition of the fact that there is an increased incidence of the virus nationwide, so it's probably in people's consciousness a bit more, and also in recognition of the increased number of rules that have been applied by government, the main one being the rule of 6, but we are expecting potentially some additional measures to be announced this evening or in the coming days, just to make sure that the spread of the virus doesn't get out of hand during the autumn. There's been a huge uptick in news just relating to this recently, so we're really trying to keep on top of that at the moment and make sure that we're reflecting those central government messages. And where necessary, for example, with our local testing routes, giving a local variation on those messages to make sure that gets through to the whole community. And that's really where we're at the moment. It's sort of keeping our ear on the news, because as Whitney said, we don't get any advance warning. So when you get that national press conference about new measures being put into place, that's when we hear it as well, and then we have to make sense of it and get it out as soon as possible. And we're expecting a few of those over the coming days and weeks. And that's all to me now. Thank you, Chairman.
Thank you very much, Tom. Are there any questions, please, on communications for Tom? Thank you, Councillor Williams.
Yeah, thank you. It's clear we're going into another dynamic period where what we say today could be out of date tomorrow. So I was wondering, when, Tom, you spoke about the pre-prepared messaging, is that likely to be in an electronic format as well as a hard format, as we spoke earlier, as you alluded to? You've done work recently about getting paper copies of things out to people. Will the pre-prepared messaging also be in a paper format if needed?
Yeah, absolutely. If necessary, we would definitely make that available. And I was actually speaking to Councillor Grossett yesterday about we're preparing some messaging for vulnerable groups on the island who maybe the messaging, even the sort of messaging we put in the letter, might not have been appropriate to that cohort. So we want to, amend it so it really is clear to them what it is that they're required to do, what they're not required to do, etc. So we are looking at that. The letter won't be the last piece of paper messaging we put out.
Councillor Williams again.
Yeah, I just wanted to say how difficult it is for certain sectors of our community. I was talking to our Director for Children's Services late last week, and the sort of message was that children can go to school, which is fine, which is great, which is what they should be doing, but when they come out of school, because of a rule of 6, they can't necessarily go and play on the skate park, which is literally across the playing field. So I just think we've got to bear in mind that even though we're passing the message on, we're doing everything we should be doing, but some sections of our community, whether they be old or young, it's sometimes very difficult for them to take in what we're saying, justify what we're saying. So I think we just need to be mindful of that as we go forward.
Thank you very much. Very wise words, Joel. Thank you. Stephen Taylor, please, next, Monitoring Officer.
Thank you, Chairman. Just a query, really, to Tom. I understand that the Prime Minister is making a statement in the Commons this lunchtime. Will we be issuing anything following that, or will we be waiting for some documentation from the government in order to make sure that we reflect what the actual orders are going to be?
Almost certainly we'll be issuing something afterwards. It's very rare that there's been a statement which has been sort of trailed as much as this one, and it hasn't resulted in some sort of immediate action we've needed to take. So I'm expecting that we'll have to put something out. Government are really good actually at following up after a statement with the sort of the script of that statement, and normally that's enough for us to get initial messaging out. And they've also been really good at pre-prepared social media messaging, which is really important. Actually, we tend to share the direct government messaging and then add a comment above it which reflects any local variation on it, because it's so important that we don't deviate from the sort of the messaging for England, across the board. England obviously varying slightly from Scotland and Wales and that, but yeah, I'd be surprised if there wasn't anything we had to announce today yet.
Thank you very much. Councillor Legg, please.
Thank you. I've been in discussion with Tom about setting up a mailing list. I was just going to ask Tom when he thought that would be operational.
Thanks, Councillor Legg. We'll be looking at that in probably in October, but we could look at it. We could certainly look at it a little bit earlier. It's just I'm thinking of timelines of other work that we're having to do quite urgently at the moment. We're going to continue to get the messaging out in the same way over the coming weeks. There won't be any sort of lack of that. But yeah, email is an option that we want to make sure is available to all residents, and they'll be in control of their own subscriptions, etc. So they'll be able to choose between emergency messaging or general council messaging, etc. I don't want to put an exact date on it at the moment because obviously this is broadcast and I don't want to overpromise at the moment. I do want to look into it, make sure we've got it set up correctly, but it's something we're looking at as soon as possible, let's put it that way.
Thank you.
Thank you. Councillor Grottick.
Thank you, Chair. Just to say thank you to Tom for mentioning that we are having some, after being asked by a carer to a group of vulnerable elderly people about possibly some simpler comms to them, not that ours haven't been good, but just more focused on that particular group. I think in view of the fact that things might change today, it probably would be wise just to carry on, but on the other hand, just wait and see what comes out of today, so that we can incorporate any new instructions that come out today into the messaging that we're planning. That's all really. Thank you.
Thank you. Any other questions, please, on communications? No. So could I please have a proposal that we note the update on communications, please? Thank you, Councillor Grottick, and a seconder, please. Councillor Williams, thank you very much. Anybody against the noting of the communications update? No, then that's carried. Thank you very much indeed, Tom. The last item on our agenda is any other issues, please. Has any attendee of this board got any other issues that they'd like to raise, please, today? No. Well, thank you very much indeed, everybody, for attending. And our next meeting is on the 20th of October at 09:30. We hope we won't have one sooner than that. But thank you very much for your attendance and your reports. And with that, I'll close the meeting. Thank you.
Thank you.
Thank you.
Bye.